back to our channel. This is Guntur Medical College, Department of Anatomy. In this dissection video, we will see the interior of the right ventricle. This is the right ventricle. This is right atrium. This is left ventricle. So this right ventricle is situated in front and to the left of the right atrium. In the previous video, we have seen the interior of the right atrium. Now in this video, we will see the interior of right ventricle. You can see this right ventricle forms the sternocostal surface, majority of the sternocostal surface, and 2/3 of the diaphragmatic surface, and it forms a part of the inferior border also. So now we will cut through the wall of the right ventricle. The right ventricle, if you see the muscle, it is thinner than the left ventricle. So this is the thin wall of the right ventricle. You can see, if you see the interior of the right ventricle, it is semicircular, semilunar in shape. Because of this, interventricular septum is projecting more towards the right side. If you cut through the left ventricle, it will be circular in shape. So this interior of the right ventricle, we have to see under 3 headings. One is this, or you seeing this is the right AV orifice and its complex. And the 2 is this rough inflow part or tract, otherwise called as ventricle proper, and this is the outflow part, smooth part, and this will be called as the vestibule of the heart, vestibule of the right ventricle. Now we will see in this, first we will see the AV orifice. We can see from the atrial side. So this is the right AV orifice. I will put my forceps into this right AV orifice. It is this approximately admits the tips of the 3 fingers, and it is 10 to 12 centimeter in width. So that is comparatively more than the left AV complex. So this is the right AV complex. You are seeing the right AV orifice now. This right AV orifice contains the attachment. It should be attached to the heart. Heart contains fibrous skeleton of the heart. So it is attached to this fibrous skeleton of the heart. This part will be called as the annulus, right AV annulus. That is fibrous skeleton of the heart through which cusps of the right AV orifice are attached. Now we will see the 3 cusps of this orifice. We will see. So one which is attached to the anterior wall. So this is the anterior wall. So this is the right anterior cusp, and one which is attached to the septum will be called as the septal cusp, and one which is attached to the posterior will be called as the posterior cusp. So in this, anterior cusp is the largest and septal cusp is the smallest. Can you observe this? Cusps are attached to the ventricular wall by this chordae tendineae. Are you seeing all these are called as chordae tendineae? So all these will be called as chordae tendineae. So what are chordae tendineae? Chordae tendineae, if you want to describe or define, they are the endothelial covered collagenous threads which are attached to the cusps. So cusp will have the, if you see the cusps, it will have a free margin, then the rough zone where the cusps are attached, then there will be the clear zone, and there will be the basal zone. So the chordae tendineae may be attached to this free margin, or to this rough zone, or to the basal zone. It is not usually attached in the clear zone. So according to their attachments, the chordae tendineae are divided into free chordae tendineae, then the basal chordae tendineae, deep chordae tendineae, according to their attachments. If you see the junction between this cusp, so if you see this is the anterior and this is the posterior cusp, this in between this it will be called as anteroposterior commissure. So some chordae are attached even to the commissure. They will be called as commissural chordae. Even we have true chordae tendineae and false chordae tendineae. If it is true chordae tendineae, it should be attached to this papillary muscle to the cusp. If it is not attached correctly, then they are false chordae tendineae. So that is about this right AV orifice and its complex. Now we will see the rough inflow part. So this is the rough inflow part you are seeing. So from the AV orifice, blood enters the right ventricle from the right atrium, and it is rough. So this part is rough, and it will be called as the trabeculae carneae. Trabeculae carneae contain ridges, bridges, papillary muscle. So ridge means they are elevation. If you see Between the smooth part and the rough part, this elevation will be called as the supraventricular crest. That is the major elevation. So these are all ridges. Ridges means elevation. Some bridges connecting the two ridges, that will be called as the bridges. So ridges, bridges, and also papillary muscle. We have three papillary muscles: anterior papillary muscle, this is anterior papillary muscle, and this is the posterior papillary muscle, and this will be the septal, very smaller papillary muscle. So these are the parts of the trabeculae carneae: ridges, bridges, and papillary muscle. So in this we have one more bridge. Important bridges will be called as the moderator band, which will be connecting this posterior papillary muscle to the ventricular valve, which is called as moderator band, which contains the right bundle of the His. So this whole about the rough inflow tract or the trabeculae carneae. So if you see the smooth outflow part, so this is the smooth outflow part. If you understand, the blood has to reach from right atrium into the right ventricle through this orifice, then it has to make an obtuse bend to reach this smooth outflow part. So this is about this right intersection of the interior of the right ventricle. We have to understand the embryology part of the right ventricle to understand how it is one part is smooth and one part is rough. Even in the right atrium we have seen one part is rough, that is musculi pectinate, and another part is smooth. I used to tell the students always to remember rough part all derived from the primitive chambers. Otherwise, rough part of right atrium will derive from the right half of right primitive atrium, and this rough part of this right ventricle will be derived from the right half of the primitive ventricle. That's the easy way to remember. So you learn the embryology part also in detail with the interior of the chambers. With the next dissection of the interior of left ventricle, we will see in the next video. Thank you.